Welcome to Carney Conversations. I'm Diane Lipscombe, and I'm the director of the Carney Institute for Brain Science. And I'm welcoming you to this discussion about how emotions can foster disease prevention behaviors during the COVID-19 pandemic. I'm here with Chris Moore and with Oriole Feldman Hall, both faculty at Brown. I'm going to introduce Oriole in a moment, but I do want to just let you all know that the only thing that's active on the Zoom feature is the Q&A section at the bottom. And so that's going to be open for you all to submit questions. And then Chris and I will be taking a look at those questions as we move through this session that will be ending at 4:30. So Oriole is an assistant professor of cognitive, linguistic, and psychological sciences here at Brown University. Oriole completed her undergraduate studies at Cornell University and a doctorate at University of Cambridge in Britain. Oriole's won a few awards. She received the Association of Psychological Sciences Rising Star Award and also the NARCED Young Investigator Award. Oriole studies human behavior, trust, cooperation, and actions, and particularly those actions in the context of reward and punishment contingencies during social interactions. Oriole and her lab are unraveling the cognitive and neural processes that underlie our abilities to make complex choices that form the framework of human social behavior and interactions. How do we assess reward and punishment during moral dilemmas? Oriole's going to talk more about the methods that she applies in her research. But just to say that it's really wonderfully multidisciplinary, bridging cognitive neuroscience, social psychology, and behavioral economics to really get at brain mechanisms. So of course, we're all watching in absolute horror as the United States is experiencing a surge of COVID-19 cases, both in regions that have had relatively few cases early on, but also in other regions that have seen a resurgence, such as in California. Right now, the only preventative medicine that we have at our disposal, or I shouldn't say medicine, I should say action that we have at our disposal, is behavioral. And that's why we have Oriole here today to talk to us about that. The recommendations from infectious disease specialists are clear, and there is evidence, very strong evidence, that social distancing, mask wearing, and other precautions dramatically reduce the spread of this new SARS virus. Despite data, large sectors of the US population are not engaging in these practices, and the consequences have been truly devastating. So in the next 50 to 55 minutes or so, we're going to discuss these complex factors that influence human decision-making, compliance. We'll talk a little bit about message effectiveness and what it might take to move cultural norms to adapt and change usual habits to mitigate the spread of COVID-19. So just again, to remind the audience, we're going to be looking at your questions. Please use the Q&A feature if you have questions to submit. And then Chris and I, as I mentioned, will be getting to those as soon as we can. So Chris and I are just going to kick off with a couple of questions for Oriole to start with. And, you know, Oriole, we were all really interested, of course, which is the topic of today, in your manuscript that you submitted on the emotional responses to pro-social messages. Sorry, emotional responses to pro-social messages increase willingness to self-isolate during the COVID-19 pandemic. And you recently put that on a psychology preprint server, and I actually just noticed one of the students who was involved in this got an award for rigor and reproducibility from Brown. Very cool.
Yeah,
so Joey, great.
Yeah, Joey, who's the lead author on the paper. Yeah.
Oh, congrats, Joey. So maybe it would be really great to set kind of a foundation to this discussion and let us know what motivated you to engage in this study. What has the response been like? And maybe you could explain to us a little bit more of, you know, the group sizing, demographics of the participants, and how you, what kind of methodologies, this is a big list, but kind of give us the framework and what kind of methods do you use to assess?
Sure.
Yeah.
So
Oriole.
I mean, this was a very much a collaborative effort. It was spearheaded by Joey Hefner, who's a grad student in my lab, and in collaboration Mark Luis, who is a postdoc in my lab. What ended up happening is, as information was coming out about COVID and we were all consuming all of this information in the news, and every day it was changing, we were sort of sitting back and we were totally blindsided by what was happening and watching this sort of spread across the globe. And I would say that, you know, the first, you know, week or even two that this was all happening, we were really just consuming all the news and taking it in stride. My lab actually dismantled. People went back, you know, Mark went back to Spain. Everybody, not everybody, but many people went back to either their home countries or different places in the US to be with their families. And so there was a mad scramble to sort of reappoint where people were going to be doing their research from and how to handle that. And after things started to sink in, we realized that we were in a very unique moment in time. So we study social behavior, and we want to know why people are motivated to, you know, be fair to one another, or to be altruistic and kind, or be empathic. And so what we have here with the COVID-19 pandemic is a unique opportunity to study a naturally occurring experiment in real time as it unfolds. And, you know, in Brown, we have, you know, lots of different expertise. What we bring to bear in this particular case is expertise in understanding human behavior. So what we wanted to look at is what motivates people to socially isolate. This is a really important thing for keeping people safe. And this was one of a myriad of questions that we were actually asking. So we have a few different experiments in the pipeline in different phases. This one we did very quickly. So basically on March 24th, we put this experiment online. And what that means is that we can, instead of bringing subjects into the lab, which is what we often do here at Brown, we posted our experiment on the internet and had people take the experiment from the comfort of their home, and we can pay them that way as well. And there are various ways to do that. A very famous one is called mTurk. Another one is Prolific. And so what that allows us to do is to get responses from all over the US, not just in Providence, not just in our local community, and to get a representative sample. So I think in this particular sample, we had about 70% white Americans, 13% Black Americans, about 4 or 5% Hispanic. And so we can look at how, you know, these factors are affecting all different communities across the US. We were very specific in looking at just the US because we wanted to see what information Americans were basically consuming in real time. So about a week before we put the experiment online, we were scrambling to basically code it up. What does that mean for the layperson? That means, you know, showing people a certain set of questions in a presentation that they can take for the experiment. And so Joey and Mark were working tirelessly basically to get this study up and running so that we could get information and get data really quickly. You know, I think we got it 10 days after, you know, America, quote unquote, shut down. So it was a great feat of my lab for doing that so quickly. It was quite amazing. And the idea was simple. It was, what type of message is most effective in garnering behavioral change, such extreme behavioral change, right? So staying home, socially distancing is not an easy thing to do. We are social creatures. We want to talk to other people. We want to hug other people. That is very much part and parcel of what makes us human. And here we're being told, well, you can't do that anymore. You have to stay home. For some people who are alone, if they live alone, that's extremely difficult. For other people like me with 2 small kids, I could use a little social isolation, but that's fine. So, you know, it's a challenging time, and we're asking people to do things that you know, goes against the very inherent thing that we want to do. And we also study emotion in the lab. And so one thing that we thought about, well, there's plenty of work that looks at messaging efficacy, right? So people use threat messages, people use pro-social messages, but what's the mechanism behind the efficacy of those different public health messages? So emotion is a very potent motivator of behavior. And we thought that different types of messages might reap different emotional feelings or experiences. And that might push people to either socially distance more or less, depending on whether the emotion was positive or negative, let's say from a pro-social or a threatening message. And what we found is that actually both a threatening message and a pro-social message on the face of it was equally good at getting people to stay home. First off, we found that people were reporting about like 87% of Americans reporting social distancing measures, which is really high. Now, that was only about 10 days into, or less, 8 days into the social distancing edict that came out of the White House. But what we found is that reading the messages that we gave people that were either threatening or pro-socially oriented increased their willingness to stay home even more. What was interesting about the data is that they evoked obviously different emotions. One was positive and one was negative, but you got better bang for your buck on the pro-social message. So the threatening message actually made people more emotional, more aroused, more negative, but the pro-social message, which was not as potently evoking of the emotion, actually was more powerful in instituting behavior change than the threatening message if you account for those emotional experiences. So another way to say that is, you know, we're in this like, you know, horrible pandemic, we're by ourselves. You don't really need to appeal to these threat-based messages. You can appeal to pro-social messages because they do just as well, if not better, in getting people to abide by these really difficult measures by evoking a positive emotional experience.
Great, thanks. So do you think then that, I mean, we're going to dig into a little bit more of the details that you mentioned, and just to flip back, your population size was about 1,000, is that
1,000
right?
people, yeah. We collected 1,000 people.
Great. So you're not able to assess this in terms of, because you took a single time point at about 8 days in, but is it your prediction that a pro-social message would be also more enduring than more of a threatening message, or is that leap too great to make in terms of your? You know,
it's an interesting question. I think that one of the challenges that we're seeing now as states start to reopen is there's, you know, a resurgence of spiking. Right. People are tired of social distancing. They're tired of wearing masks. They don't want to do it anymore. And so a really good follow-up question would be, what has lasting power? So I don't know the answer to that. We haven't run that study. What I can tell you is that, you know, from a political sphere, politicians are very keen to adopt threatening messages. So it's a very powerful way to garner support and to bring people into the tribe, basically. If you already are within a particular in-group, getting everybody behind some external threat, in this case, the pandemic, is easy to do by using that. And so it's adopted by our current president. It's been adopted by past presidents, and it can be, you know, very efficient in getting people to do what they want to do. I think it's harder to get people not excited, but to get people like amped up or aroused, to use the emotional language, for a more pro-social message. It's a little bit of a quote unquote harder sell. So you have to choose your language more carefully. So without having actual data in hand, I would say that, you know, the threatening message might have lasting power just because it's easier for people to talk about it. It's easier for politicians to deploy that language and use it. And in fact, in our study, it was partially inspired by a Medium article that was telling Americans that basically it says COVID is coming for you. It doesn't, doesn't know boundary conditions. It's gonna sweep through your house. It's gonna leave you devastated. And it was using really threatening language. And we were thinking like, this can't be real. Is this this was actually published? I can't believe they're publishing language like this. And so that was actually one of the inspirations for looking at this type of language and in its efficacy in getting people to change their behavior.
So Oriole, we've all been listening to so many podcasts that what is there to do? But there's this really great podcast that I was listening to by where Daniel Kahneman was being interviewed, and he was talking about breaking down behavior around the COVID-19 recommendations, and really spoke to, as many people have, the importance of seeing people doing the right thing, and that this was just so incredibly important, so that image and images and as you were talking about like staying positive, I mean, I'm paraphrasing and taking liberties with what you just said, but like, going for the pro-social messaging, there's so many examples of that working so brilliantly well. And in the little news and views that you wrote for us around your article for the Carney website, I noticed, I don't know if Sarah, our communications manager, put this poster up, but that "We Can Do It" poster that came out in World War II by Howard Miller. That's so very positive, right? But the goal was to get the women in the factories to work harder and not complain, and to just keep doing it for less money and for more hours. But it was a super positive like image. So I guess there's a question there. But how do you think about the relative efficacy of words versus images versus role modeling?
Yeah.
In this moment, in time, which we're lacking of some, I would say.
Yeah, that's a great question. So I think you're hitting on 2 points there. One is, images versus words, and the second is role models. So let me tackle those each in turn. I think the idea of images is really put into relief if we actually go back about a decade to the Syrian refugee crisis. Mm-hmm. So there was a number of years when when the Syrian civil war took off, and I think it was in 2011, and millions of Syrians were being displaced. And major newspapers like The Guardian, for example, would publish these incredible photos of these camps that these refugees were going to that would extend for miles and miles and miles and miles. And it was just unbelievable. And yet the world wasn't listening. Yeah. And that's partly because it was a stat, it was a number, there was no face on it, there was no ability to connect. And then a couple of years into the crisis, the Daily News, I believe it was, published this like heart-wrenching image, which is just like thinking about it is very emotional, but it's a Syrian boy who's lying face down in the sand, and he's drowned, crossing over. And when the public consumed that image, the world woke up. And everybody started donating money, and the donations came in like on an order that they had not seen in the years before. And it was just incredibly powerful. And I think that, flipping the narrative in that way, showing this image, in this case, it was not a positive image, but that image of one boy did more to change the world's understanding of what was happening than the image of thousands of people displaced, or even millions of people rather displaced over the past couple of years. As humans, we respond better to imagery than to stats. And there's really good research that talks about this and that explores this dynamic. It's hard for us to understand numbers. And this is actually one of the issues with COVID, exponential, for example, like what does it mean? Exponential, most people, this is actually another project by one of my students, she's looking at how poor people are at understanding the exponential rise of COVID right now, and estimating into the future. That's work led by one of my graduate students, Amrita Lamba. So what she is finding is that, you know, people are doing a very poor job of figuring out what exponential means, how do you yoke those numbers to the future. And the point I'm trying to make is that images can be much more emotionally evoking than anything like numbers or words. And so, you know, that's part of the reason, you know, we wanted to look at the emotional component of these messages, of these fearful and pro-social messages. The other idea that you brought up is role models. And I think this speaks to what is a social norm? How do we think about what other people are doing out in the world? So, you know, if we're talking about, you know, racial injustice, or if we're wearing facial masks to stop the spread, that then becomes the norm. If you see somebody walking down the street wearing a face mask and you're not, you become self-conscious. If you turn to our president who's not wearing a face mask, it says, okay, well, if he's not, why should I? What's the importance there? And so role models have sort of a special, you know, place in enabling those social norms to thrive. And it's really important that they do those things. So if you know, Donald Trump were to go around wearing a face mask everywhere, the ability of the Americans to get on board with doing that and not seeing it as, you know, whatever the issue, there's all sorts of psychological issues that, you know, people are talking about using face masks, but whatever it is that people can't get behind with using face masks, that would be put more to the side, because there would be a role model who holds a very prominent position saying, I'm doing it, why aren't you?
Great, thanks. Actually, one of the first questions that came in really related to the first question I asked you, so we're paralleling and aligned with the audience right now. Chris, do you want to jump in here to ask a question, and then I'm going to take a look at some of the questions that are coming in from the audience.
Sure.
Why don't you take it over? Great, Chris Moore.
Yeah, thanks, Oriole, for joining us. I mean, the study is great. I mean, it's rare that you have really great basic science progress that could also maybe impact the world. I think people sometimes wait their whole career to publish a study that might actually do something that's meaningful. So congrats on it.
Thank you for your kind.
Yeah, let's, you know, people will or won't notice, but at least they could. So one of the dimensions for this that comes up for me as someone who pretends he's logical as a scientist. And I, you know, we're always reminded that when we see charismatic leaders or offensive leaders or people that convey messages, that we're always surprised to learn that it matters how they convey them. And yet it's maybe the oldest thing. You know, this goes back to Caesar or to cave people or something. Still, there's this sense that we always have that we'd love to be able to think through the problem and then act on it. And one of the things that I take from your study is that both the pro-social approach and the threatening approach are incredibly potentially powerful at changing people's views. In other words, if a politician wants to turn that switch and influence us in one direction or the other, they've got a lot of weapons at their disposal of changing our behavior. Again, I know this is well appreciated, but it's one thing that quantitatively and really powerfully comes out of your study. So maybe this seems off the direction, but you know, as a private citizen, that feels scary in some ways, right? To just have it laid bare in your study how much we can be manipulated in our views by the emotionality of the message. So there's a couple different dimensions of this I want to ask about. One is, you know, building on either what we're learning in social neuroscience or other things, are there ways to train ourselves to be more immune to that sort of, not manipulation, but let's call it manipulation. So you know, some people like Kabat-Zinn and Richard Davidson claim that meditation can do this. Maybe there are other approaches, but are there systematic things people can do to try and hold on to their own sense of judgment and not just get pushed around as much by the way it's framed? Are there new insights or old insights in social neuroscience that we can apply to protect ourselves?
I think this is a great moment for me to make a plug that emotions are incredibly important for adaptive behavior. So the idea that you have emotions on one hand and, cool, reasoned, logic on the other hand is a complete misnomer for how we ought to even be like navigating through our social worlds. So emotions are basically our proxy for something is good, I should approach it. Something is bad, I should go away. If you didn't have emotions in that equation, you would be in very bad situation.
Of course, no. To be really clear, I'm not disagreeing with the importance of emotions, but when it comes to a policy choice about like your risk relative to a virus, and you'd like to think about it and make the best choice, part of it's going to be driven by a lot of things, but I'd rather have my own emotional response and not be given one by the messaging. It's the messaging that I'm concerned with, how it might manipulate me, not that I might react some way.
Right. Yeah. So you mentioned, meditation, and there's lots of other tricks of the trade that one can do to help with this. So like cognitive reappraisal or emotional reappraisal is another trick. I think that one thing that happens, especially with situations like we're finding ourselves now with the pandemic, is that people tend to get overwhelmed and they shut down. And if an emotion bubbles up too much and it becomes overwhelming or too anxious, then, and you see this a lot in the threat and the fear literature, that if you evoke too much emotion, too much fear, basically from a threatening message, that the person reading the message or consuming that message basically disengages. You have no efficacy whatsoever with that message, and that's potentially quite dangerous. So a lot of the fear messaging work suggests that you have to basically calibrate it just right. You have to just hit the perfect amount of fear to get people to motivate and to behave. And then there's individual differences, right? So, people behave or respond differently and have, a different barometer for what gets themselves feeling fearful or get their anxiety up. And so it's kind of like a muddy place to play in. It's a difficult thing to get just right. That's another basic reason, actually, I think that the pro-social messaging can be more powerful, because it seems to be more wholesale across the board, getting people to change their behavior without sort of the little stickiness of, oh, I just did too much fear here. Oops, I didn't do enough fear for this person, and so on and so forth. But yeah, there's lots of stuff that shows that you can help to control your emotional response. And if you can do that, you can, look at the facts or look at the data. But, I think that, part of that emotional response is really important for interpreting the data well and figuring out whether your response is well calibrated to what you're getting. Some of just one more thing, some of our unpublished data shows that people who have anxiety, who have an anxiety disorder, basically, are much more fearful of COVID-19 than individuals without anxiety. So basically, if you are anxious in general, if you have effectively generalized anxiety disorder, you are finding COVID-19 to be a much more threatening and fearful experience than someone who does not have trait anxiety issues.
Right. And so am I getting it right to say that part of having that extra dimension of noticing your own response to the information emotionally can be an added benefit in making judgments about the messaging if you're using it the right way.
If you're using it the right way. And of course, as you mentioned, There's lots of things that can amplify that. So one of the other things that we found in our data is that media consumption can be quite dangerous for how fearful you are of COVID-19. I myself noticed that the more information, more news I was consuming in the early days about what was happening, it coming out, and it was, I was thinking about it all the time, was not a good headspace for particularly for myself. So what we found is that the more information people were consuming about COVID-19 through news or through social media, the more reported fear they had about COVID-19 and the pandemic and how it was unfolding. So that would be a very easy way to say, okay, I'm going to get some news. I'm going to consume some social media on this. I'm going to keep myself up to date, but I'm not going to go down a rabbit hole and generate those really negative, fearful feelings.
Yeah, there's one thing that I've heard said. People like Jaron Lanier have said this, that they actually claim that the degree to which people in general are willing to go over to certain kinds of leadership, he thinks is correlated with the rise of AI bots that play on putting us in that news-driven fear state. So we'll click more on an item in Facebook or an advertisement or something. They know that clickbait works better if they can arouse that kind of anxiety.
That's right.
Individuals. And he claims, at least, that the rise in totalitarianism internationally can be benchmarked to when Facebook and some other social media dimensions came online. But it very much goes to the idea that news sells, even news sources we trust, they know that they sell more if there's a crisis, and they can get us in the mode of needing to see the news all the time.
Right. Yeah, and playing to that emotional component. Yeah.
Which does drive, as you point out really nicely in the article, does drive attention very incredibly saliently, of course, right? That's maybe the reason we have it in some sense.
Right. Yeah.
Diane,
Sorry. Yeah. Go ahead, Chris.
Oh, go ahead.
Yeah, I was just going to say there's a few. I'm just scanning the questions now and thought that maybe I'll just continue a discussion around the media, since a question just came in around this. Not completely linked to what you were just talking about, but asking whether given the media is utilizing a lot of impersonal kind of large umbrella terms and stats to describe the pandemic, do you think that makes people less inclined to believe that there's something that can happen to them? And so we talked a little bit about the importance of images. And just more generally, again, asking, in what ways does pro-social messaging help people to understand the realities of the pandemic? Can you make a link there, Oriole, in terms of pro-social messaging?
Yeah, so just so I understand, is the question about what the content of the media is and what that people are reading and how it changes behavior? Is that what?
Meaning, so the first point is the impersonal nature of the information that's being kicked out through the media.
Yeah.
And so that we, humans are looking at that and thinking, oh, well, that's fine, that's not happening to me. I think it parallels the image that you just flashed back in our minds about when you deal with big numbers and big scenes, then that's very impersonal. And how do we think about making it much more personal?
Right. Yeah, no. So I think that's very true. There's also, a lot of people are following, or they were at least in the beginning, the uptick as it was happening in real time. So like, for example, Johns Hopkins had a website where you could follow the cases and you could watch the numbers rise. And again, that's a very impersonal way of consuming what's happening around you. In the beginning, a lot of news outlets were doing that, right? So they were just taking the numbers because the numbers are in fact shocking. What seemed to happen, at least a few weeks in, and this is just from my own sort of observation, is that some news outlets began running more personal stories. This ultimately accumulated in the New York Times running a quite powerful page where it had like all the names of Americans who had died, about 100,000 at that point to date. So that was a big number, right? And that was like effectively like a stats game. But if you went inside and you started reading, there were little blurbs about, you know, each person, and it humanized them, and that was like a really important function of that piece. And so what a lot of news outlets started to do after the first few weeks, where it was just a numbers game and a stats game, is they started to humanize the pandemic and talk about, you know, a whole family was lost a grandmother, a mother, and a father, and talked about sort of the trials and tribulations of that family's struggles through this pandemic. And that creates an emotional landscape that people can hold on to, that people can remember, that people can attend to in a way that, yes, it's startling to see this list, this huge list of names, but when you're sitting down at, you know, dinner and you're talking, you know, to your spouse about everything, it's those the emotional story that you read about a particular person struggle through this, that you can talk about, that you can actually anchor into. And that's what ends up being the most, I think, that moves the needle the most. And, you know, our research shows that as well.
And so then a request to kind of circle back, having said that the most emotional responses that can be obtained, or to use these images that we all you know, relate to, is that so back to Chris's point, this is to some extent a form of kind of, you know, emotional blackmailing. And so how do you think about ways in which, you know, in terms of responsible messaging, I don't know if that's reasonable in this case, how one balances giving, you know, showing images which really impact, you know, our emotional reaction, looking how we can look at data independent of those emotions. Is that possible? Do you think, have you thought, or can you think about, is there a fair way to do this? And then, as Chris said, thinking about ways that we might approaches that we could apply to be able to parse those things out.
Yeah. Yeah, it's a good question. If we have some sort of social responsibility to be careful with our messaging, right? So, I mean, this, I think, comes down to what's the goal at the end of the day? Is the goal to have people socially distance? I mean, one of the things that has not been a topic of conversation in the mainstream news, at least until very recently, is what are the effects of social distancing? So depression is on the rise. I mean, depression is at an all-time high. I mean, it's confounded by other factors such as unemployment, and, you know, many things are toppling all around us. But social distancing, like, you know, as I said in the very beginning, we're social creatures. This is what makes us happy on our day-to-day basis. And so, you know, it's one thing that we have to think about through this is, if our goal is just to socially distance, then you basically want to take a sledgehammer approach to get people to do that. But I'm not sure that that is the best approach, because you also have to take care of people's mental health and well-being. And I think in the beginning, when there wasn't that much information known, the goal, understandably, was just to make sure social distancing was happening. But it too has, you know, detrimental effects on us. And so I think my personal opinion is that we do need to be careful with our messaging, that we have a social responsibility to take care of ourselves in a more nuanced way, and to weigh the cost and benefits of the fact that social distancing does have very nefarious repercussions for our mental health and well-being, and how we, you know, engage with the world.
Right. And this comes, I mean, making again a leap to some of your really beautiful work, I think published this year, looking at how individuals with anxiety versus those that don't have diagnosed anxiety, how they're able to adjust to constant changes within, you know, social context, and learning to adapt. That's particularly difficult for those who have anxiety. And so what in thinking about, you know, this constant barrage all of us. You know, are we as a community, you know, becoming more and more anxious? And is some of your earlier work comparing, you know, non-anxious and anxious individuals, is that, could you apply that to challenges that we would have individually as we hear more and more of this information, and that at an individual level that we could become less able to adjust within kind of complex, ever-changing social environment?
Yeah, yeah, absolutely. So, you know, in the sample that we collected, I think the depression rates were around 50%, maybe just under, which is, you know, in the, for us, we don't have a pre-COVID sample, but to give you an idea of the lay of the land, depression in general is around 10 to 13% in the population. So I'm a little hesitant to jump on that number too much, just because we don't have a pre-COVID sample, but it is like a startlingly large sample. And other researchers have come out showing that the peaks were really high right when we took our sample as well, but have actually come down quite significantly in the past month and a half. So that it was, you know, not this long-term, you know, feelings of depression, but sort of just a spike that happened. And now, at least, you know, for some people it's coming down. I think there was like a shock to the system, effectively, of the social distancing and what was happening all around. The thing about anxiety, you know, that research, what we're looking at is how anxiety changes our ability to deal with uncertainty. And if there's anything about our world right now, is that every day is uncertain, right? So we don't know what's going to happen next. Like we get more information, you know, so right now my family is, you know, trying to think through all the machinations of sending our children to school, and what that means for our family and for my mother, who's, you know, in a high risk population, all these things. And there's just not enough information. And so you have to make these decisions without having, you know, good evidence in your hands. And that's hard in the best cases, right? So when we did that research, it was pre-pandemic, and we were just looking at, you know, everyday uncertainty, the uncertainty where, you know, I'm looking at you guys and I don't know what Chris and Diane are thinking inside their heads. You each have your own private lives, right? And so that's the uncertainty that we think about from the social world, is like, how do I navigate that? Do I take the smile as, yes, she's saying the right thing? Do I take the frown as, oh, reroute, talk about something else? You know, these are the things that we think about as we're trying to navigate our social lives, but everything has just been blown into like this enormously uncertain space. And that makes it a really difficult place for people to make decisions, to learn, to navigate. And so in that sense, there's like this unprecedented space of trying to make adaptive decisions without having, you know, good evidence, good ideas, or, you know, good anchoring into the reality of the situation. We have to simulate so much. And that's a hard thing for us to do. Humans are really bad simulators. We need all the tensions that are right around us to make the good decisions, the best decisions that we can.
Let me follow up. It's the connection to depression and anxiety is just, it's sort of terrifying what it means. It's a secondary public health crisis, like you're pointing out so well. It's really one of, in the context of anxiety and decision making, one of the questions that came in that I think fits here is, what do you think about the effect of public health experts changing their advice regarding social distancing on their trustworthiness, but more generally the question of who people, you know, trust is by definition trust, or something like that, right? Like it requires a leap of trust, right? And you don't personally know Anthony Fauci or someone saying something different than Anthony Fauci. Can you talk about how that the presets people might have about trusting certain kinds of information are playing into this, in addition to what might be going on in the messaging?
Sure, yeah. So basically, trust is taking your own welfare and placing it into the hands of another. It's a risky thing to do. It's a very uncertain. And we're doing that right now if we're taking recommendations from people and changing our lifestyle to accord with those recommendations. So what happens when the recommendations, you know, say wear masks, don't wear masks, no wear masks, and so on and so forth. So here's the thing. Everybody is an imperfect, knowledgeable person, right? So we have new evidence coming in all the time. I think it would be socially irresponsible, and in fact, immoral for us to, hang on to something that was said on March 14th before we had any knowledge, because, we said it once, we have to keep saying it. That's a rule. As information comes in, as we can update our, epidemiological models in a better way, we have to update that information. We have to be able to take that new information and revise what we're doing in lockstep. The inability to do that would actually be more harmful for the American people and people elsewhere, around the world, than to just stick with the same thing because it was said once on a particular date. I mean, that's what science does, right? So in our field, a study might come out that, refutes a study done 5 years ago or 40 years ago, whatever it might be. And then you have evidence on both sides. What do? You collect more evidence and you fine tune your ideas about what the ground truth is based on incoming evidence. And we are in a constant search to do just that.
So Oriole, I wanted to jump back to your study that kicked off this discussion. One of the participants is interested in knowing a little bit more about whether you're able to parse out any information about the demographics of the participants, and they had a particular interest in whether you noticed any trends in the responses from Asian American participants versus others. So is your data set large enough to do that? And did you look at other demographics within the responses that you got from the participants?
It's a great question. Our data set is large enough. We have 1,000 people, but we were not a priori, meaning prior to running the experiment, interested in the demographic breakdown of, let's say, who was social distancing more than others, let's say based on religion or race or something like that. And because we were not interested in that, we only ran, one of the things, in our field that's really important is for researchers to not just, blindly go fishing in the data and looking for, anything that might pop up, but come to the table with, a very specific hypothesis and test that hypothesis. And so we actually do have that data, and I could probably tell you if we looked at it, but we haven't looked at it primarily because we weren't thinking about that specific set of questions when we put the study together.
Hence why Joey got the award for the rigor and experimental design of your study. Yeah. Do you want to say a little bit more about that? Because I think it's super important. And maybe, I'm sure, you could describe it really quite beautifully well, that if you have a data set, you go in with a particular hypothesis to test, there of course is a temptation to just continue to go in and test a whole bunch of other ideas. Could you explain why that is probably not wise, and where the errors start to creep in as you start to test more? Yeah.
So basically, when you have a data set as large as this, 1,000 people, you've looked at various different things, it's easy to find things that might look like they belong together or they might work in lockstep when they don't necessarily, just because our data is so big. Because of that, you have to be very careful of analyzing the discrete questions that you have and making sure that you've already thought about, well, this makes sense for these two, let's say, variables or two factors to work in lockstep together. So I'm just going to look at that. When you start testing all sorts of different machinations, you might find something, and as our hearts are all in the right place, it may not be anything. It may just be noise. And so you have to be very careful of that. So, Joey, put the data up. It's public. People can access it as they want. One of the things that we wanted to do right away is, I think from conception of the experiment to writing the manuscript and submitting it to a journal took us about 3 weeks. So it was like the fastest thing that I've ever done. We were just like, you know, working. And also making sure that the data went up so that other people could use it and explore the data set, and maybe make, you know, helpful inferences for what we can do differently or how we can think about human behavior in real time. And so that's something that, you know, we've never done before in such a quick fashion. Usually we hold on to our data sets before, until basically the manuscript is published, and then we open up the data set. But in this case, we thought there was too much on the line, and if anything could be useful or relevant to any other sort of academic team or a set of scientists, we wanted them to have access to that too. And so, yeah, so Joey got an award for all of his
brilliant
work on that.
And then just before I flip over for Chris to ask something, there's also I think you said it in a different way, but in the same message, that if you continue to test and test, you increase the likelihood that you're going to see something by chance.
Exactly.
And so the more hypotheses and the more tests that you apply, the more likely you're going to get an error from chance.
That's from
chance. Right. Okay, great.
Exactly.
So a couple of the listeners, there's a stream of great questions here. One that's come up several times now is specifically something we touched on a little bit, but given how much is coming up, it's good to emphasize: masks and messaging about masks has been incredibly political. And of course, all this fits in the backdrop of, you know, trustworthiness, right? If you're of a political affiliation, it would be very natural to potentially trust someone of a similar political affiliation. You said, you know, that's not hard to predict that might be true. And with the different kinds of messaging that's coming out about masks, can you just weigh in on this? Like, how does this fit within, you know, the trust piece and the emotional motivation piece that people are or are not using? You know, what's the degree to which certain groups are using threat, if it would be effective, but they're choosing not to, for example?
Right. So it looks like there are regional differences in mask use. There might also be some demographic differences in mask use between, let's say, men and women. I think women are wearing the masks at a slightly more frequent rate. But the science to now is pretty unequivocal that masks, perhaps not surprisingly, stop, you know, any sort of spit or ability for the viral load to go out into the world. And so, you know, it would seem on the face of it that as states are reopening, a very simple, easy measure would be to wear masks in public, because by doing that, you can go about your daily business, you can, you know, go to the market, and you can even interact with other people without sort of transmitting the virus or having, you know, a fear of transmitting the virus. So it would seem, you know, at least at this point in time, that the message should be very clear: wear your mask. So that's what I would say.
So I'm gonna actually pick one of the first questions I think that came in, and I think that there's a little bit of an overlap here, but I just want to get through some of the questions that were actually submitted. And so one of them is related to thinking about intrinsic motivation versus extrinsic motivation. I think we've covered this in a variety of different ways, but maybe you could just cover this a little bit more directly. And so the question is, how would, I'm not actually sure, intrinsic motivation versus extrinsic motivation, I guess self versus what other people are suggesting to you. But I think that what you're telling us is, of course, one can't easily pass those out and then be able to disentangle them. But can you say something about the weight that we as humans would put on those different motivating factors with regard to, for example, willingness to stay at home or socially distance during the pandemic?
Yeah, so I think the only way I can, you know, think about parsing that, at least on the fly, is by, you know, looking at social norms and then what people would say that they would rather be doing if they were even, you know, comfortable saying something like that. So if you don't feel like you should social distance or you shouldn't wear a mask, but everybody around you is, and therefore you are, that would be a decoupling of these two things, of like sort of the intrinsic, I don't want to, but the extrinsic world is telling me I should, and therefore I want to fit in. I mean, we are, you know, social creatures, and we go with the crowd. We do with what, you know, everybody else is doing. So that's actually why, you know, having our leaders and the people all around us wearing masks and doing social distancing exercises is really important, because if you're not, you are the oddball out. You're the person who's not engaging with the social norm. So that would be the only way to parse that. But I think that, you know, a lot of times it's easy to think about the world in these sort of like black and white scenarios, right? Is it extrinsic or is it intrinsic? You know, is it logic? Is it emotion? And the reality of our world is that it's always some sort of muddied mix. And we do want to understand the weights of that. We want to understand, you know, how much more is intrinsic to extrinsic or vice versa. But that's, you know, that would be really hard to do. And in this case, I don't have any good evidence one way or the other for how we could weight those two things in terms of COVID-19.
Okay, fair. So what I want to do is to kind of circle back to thinking about people who are trying to deal with this crisis, who have underlying mental health issues. And we've talked a little bit, you know, about anxiety, and then you've mentioned the not tested, but some indication that even that there's an increase in depression rates, and certainly we've heard that in the media, we've read about it, and then your data are looking to support that. So have you, could you, and can you, from the perspective of thinking about how we as individuals react to uncertainty, and then considering individuals with underlying anxiety and other mental illnesses, do you have advice about how they might cope with the uncertainty in this pandemic? You and Chris kind of were trying to explore that and thinking about meditation, but I just kind of wanted to pull our discussion back to that issue around mental illness before we close out.
Yeah, sure. So I guess I would have, just in the last few minutes, only two quick answers for that. The first is, you know, being able to forecast effectively or simulate is something I mentioned earlier, is a hard thing for humans to do. And so there's something in our field called intertemporal choice, which is the tantalizing goodness of something in the here and the now that maybe is less good than something in the future. Because it's distant, it's uncertain, we don't know if it's going to happen, we can't touch it and experience it in the same way as what we can do in the here and the now. And so one thing that people try to get other people to do is to simulate all of those experiences of what that future reward or that future thing might bring. And if you sit in that and you think about that and you carry forward in all of its different ways what that future reward can bring you, it can help you wait for that reward. And so in this case, if you're applying it to COVID-19, that would mean effectively doing certain measures now that may be uncomfortable, like mask wearing or social distancing, for the end of the pandemic in a nearer time frame, or being able to ultimately go out, you know, to a restaurant with friends, and so on and so forth. And so, you know, thinking about those two things in really crystal clear terms and really trying to simulate through, you know, being able to do something and what that would be like could be a powerful a motivator to get people to abide by these social distancing measures. And then the other thing is the simple thing I measured before, to curtail your media consumption and make sure that you're taking care of yourself, that you're not, you know, going deep into lots of like sort of, you know, really bad news articles that are covering very, horrific tales of what's happening, but to get your news consumption and then to push away and do things that are good for your, sense of self and, mental well-being and sleep. Get lots of sleep.
Okay, well, thank you. And thanks for letting me put you on the spot there. It's definitely selfish motivation here by all of us. So avoid the things that we know typically make us anxious, because it's already an uncertain and anxiety-provoking time.
Okay.
Oriole, that was really great. It was fun.
Thank you for having me. It was a pleasure to chat with you both.
Yeah, and it was really great to see, I think that we have our research going, as Chris, I think, said at the beginning, and then suddenly to break out of that, respond to this moment in time, I think is just super admirable and really great that you did that. And
to my lab, who did it so well without sort of, missing a step. They're like the true heroes of this. They're scattered across the world right now, but they're really the ones who have just been remarkable in all of this.
Well, a great shout out from you to your lab. So we thank them too.
Yeah.
Thanks, Oriole. So I'm just gonna thank everyone for participating and for your questions. And then to just mention that look out for the date for the next Carney Conversations, which will be with Stephanie Jones, who's an associate professor of neuroscience at Brown, and Frederica Pretzner, who's going to be joining Carney as director of the New Carney Center Science Program. She's currently stuck in Switzerland, and so we're trying to figure out how she can get from Switzerland to the United States. But we're really excited to have her on board at the Institute. And so they'll be discussing applications of traditional brain recording techniques like EEG, but how they are now being paired through their research and others with new exciting computational tools to inform brain mechanism in health and disease. So stay tuned. Thanks, Oriole, again. Thank you, Chris, always for joining. Take care.
Bye-bye.